Hey guys, Lindsay with Empower and Movement Physical Therapy. I want to show you a way that you can set up traction for yourself at home. So if you're having some neck issues that are causing some numbness and tingling going into your arms, if you just have a really stiff neck and you keep stretching it and it's just not doing the job, sometimes just getting some joint distraction where you're pulling the joints apart a little bit will help bring some blood flow like into some of the deeper muscles and into the joints to help lubricate them so you can move better. This is also really good for anyone who's an overhead athlete, or if you're at the gym and you've been doing a lot of like overhead pressing, you really have to watch that head position because as you get fatigued, your head is gonna wanna like go forward and that can get really pinchy back there. Another population that this is great for is people who have carpal tunnel. Like if you think it's coming from your wrist, that's definitely a possibility, but a lot of times when we see people for carpal tunnel here in the clinic, there's often a neck component to it as well, where a nerve is getting either somewhat pinched or irritated up the chain, and that can significantly help with some of those carpal tunnel-y type symptoms. So this is something you can try at home before you decide you want to invest in either like a home traction unit, and those can run you between like $300 and $500. They're a little bit of an investment. Before investing in like an inversion table, for example. This is just a great way to test it out. So this little homemade contraption, I took a towel, rolled it up, taped the ends together, took a band and then looped that like through the bands and tied it in a knot. And always, of course, check your knots, make sure everything's all nice and tight. And then I tied another knot on the other end. The knot on the opposite end goes on the other side of the door. So put it right below where the door handle is. And then close your door, make sure it's fully secured and that's not going anywhere. And then the back of your head is going to rest in the towel like a little cradle. And so you're gonna be down on the floor, and then this is going to go right underneath your head. And I have a giant head, so this is actually a little bit too small for me. But then you move yourself away from the door so that that band is pulling on you. And normally, if you don't have a giant head like I do, you'd be able to get your head into that hole and the band is pulling through there and you get a really nice stretch at the back of your neck, and sometimes it'll even go like down underneath your shoulder blades, like at the upper trap area. It all feels like really, really good. If you're like here, like my head is suspended a little bit. And so if that's uncomfortable for you, grab a couple of pillows and put those underneath. You wanna be as relaxed as possible when you do this. If you want more of a pull, just move farther away, just inch away. The more you do this, you'll kind of find the sweet spot on your floor where you get the optimal amount of pull. Another thing you can do too is sometimes we really benefit from getting, like I was talking about, that joint distraction. And that works really well when you can turn that into like a pumping motion. And so if you're laying like this with your knees bent a little bit, then if you do a little pelvic tilt, like you tighten your abs and flatten your back and then you relax it, it's subtle, but you'll see that like when I flatten my back, I move a little bit closer to the door. And then when I arch my back, I move a little bit more away. And so the band doesn't pull as much and then it pulls more. And so you get this like kind of pumping mechanism that helps bring out any of like the gunky stuff that's sitting in your joints and brings in some nice new fresh blood flow and synovial fluid so that those joints then move better. When you do this, I'd recommend spending a good like 10 minutes down on the floor. You can go longer, you can go shorter, but 10 minutes is really like a good benchmark. It really takes us like a solid like minute or two to just like find your position and relax. And then the rest of that time should be spent just allowing your muscles to like rest and stretch. You can do that as many times really as you want. You can go either like once a day, twice a day. You can do it as needed. Like if you find that like after work, that's when your hands are more tingly, then just do it after work. And then as you go on, if you feel like you need it less, then if you're just doing it like 3 times a week, that's a really nice maintenance program. So ultimately like 30 minutes a week and you're good to go. If you also want more of a pull than just like that band would provide, I've used like the inner tubes of a bike, and you put the stem on the other side of the door, and then you can like pad it with a towel, or even just put the tube like directly behind your neck, or you can use more like looped bands like these, and you just have to find something that you can like loop it around and tie it to, and then put your head down here so that that loop is resting right below your skull, and that'll pull on your head as well. So give that a try and see how it goes. Thanks, guys.